That list will also be linked on the description of this YouTube video. In addition, the only RNSG course you are eligible to take prior to being accepted into the program is RNSG 1301 Pharmacology, which must be less than 5 years old. We do encourage students to take all of these courses before the program actually starts in August of each year at Montgomery. So this is what our checklist looks like for the basic track program. And if you have your checklist in front of you, we will provide the link for that in this YouTube video. I would just circle number 2, number 4, and number 6. Those are going to be the classes that you're going to need to work on as you're getting ready to apply to the program. Number 2 has to do with your minimum math competency. So some people will need to take Math 0310 and make a C or better to be eligible. Another option would be to take Math 1342 Statistics with the NCBO if required. We don't require that class. It is a college level math class, but if you earn a C or better in the college level course, then you would be eligible to apply to our program. And most BSN, Bachelor's in Nursing programs, do require a statistics course. So talk to your advisor about options based on your TSI scores as to which way you should go. Should you go with the Math 0310, make your C or better, then be eligible to apply? Or should you go ahead and take your NCBO with the math statistics class, Math 1342 Statistics, make your C or better in the Math 1342 to meet this requirement. Number 4 talks about the 2 absolute prereqs, and we've already gone over those. Just want to highlight those again. So those would be your priority if you're getting ready to be eligible to apply to our RN program. Number 6 goes over the additional courses that are not required to apply. However, we do highly encourage students to finish these before they start the program. This is our score sheet for the Associate Degree Nursing Basic Track program. Box number 1 has to do with the GPA that you have earned for your 2 prerequisite courses. You do need a minimum of 2.7 when you average the 2 classes together. Notice that I can use either the Biology 2401 or the 2402 Biology, AMP1 or AMP2 in calculating this score. So whichever one is higher, we can average that with your English 1301 grade. The next box has to do with the HESI results. And you'll notice that the minimum score for the 5 sections on the left-hand side is a 75 for each section. And then you'll notice in the middle it talks about the critical thinking section. The minimum score needs to be a 750 or above to be eligible to apply. Now next year in 2021, these scores will go up some. So please check back for the new minimum scores on our website. The next program we're going to talk about is our transition program. It's also an RN program, but it's specifically designed for people who are LVNs in the state of Texas or paramedics, and they wish to transition to an associate's degree in nursing and earn their RN licensure with the state of Texas. This program is a 1-year, 12-month program from the start date. Once you graduate, you are eligible to test for your RN licensure. We start in June of each year at Montgomery, Tomball, and North Harris. Kingwood starts in August. More information about current deadlines can be found at this link. And again, this link will be provided on the YouTube video. In order to be eligible to apply to the transition program, a student must meet the college level placement requirements in math and also have completed the 3 prerequisite courses with a minimum GPA when you average the 3 grades together of 2.7. Make sure all of your courses, if you're transferring them in from other institutions, are showing up in your course history on your MyLoneStar account prior to the application deadline. It's always a good idea to submit official transcripts early in the process and verify that all grades that are going to be looked at by the nursing application are in your MyLoneStar course history as soon as possible. The 3 prerequisites are listed in red here: Biology 2401, Human Anatomy and Physiology 1 within the past 5 years, English 1301, that's English Composition and Rhetoric 1, and Pharmacology RNSG 1301 is another prerequisite for the transition program. It must be taken within the last 5 years. These are the 3 absolute prereqs. The grades must be posted and in MyLoneStar prior to a student being eligible to apply. The next slide talks about the additional courses that we do recommend you finish before the program starts. At the Montgomery location, that's in June. So hopefully you have all of these courses completed prior to the program starting in June. They are Anatomy and Physiology 2, Medical Microbiology, General Psychology, and one of the courses on our approved Creative Arts Language Philosophy Culture list. Again, that list will be provided as a link in this YouTube video's description. This is just showing you our checklist for the transition program, and again, we'll provide that link. If you were going to be getting started taking courses to prepare to apply in the future for our transition program, I would circle number 2, which talks about our math requirement again, number 4, which talks about our 3 prerequisite courses that are required prior to being eligible to apply, and number 6, which talks about the additional courses that are not required to apply, but that we do strongly recommend that you take in advance of starting the program. This is our score sheet. How we determine who is selected for the program is based on an 8-point scale. And you will see that in box number 1, we average your 3 grades of your 3 prerequisite courses. Again, just like with basic track, we can use the higher grade out of AMP1 or AMP2, Biology 2401 or 2402. These grades have to be within the past 5 years for us to look at them, and your Biology 2401, since it's the prereq, must be within the past 5 years to be eligible to apply. The English 1301 grade and the Pharmacology grade. So those 3 are averaged together, and it must be a minimum of 2.7 to be eligible to apply, but obviously the higher the better to be more competitive on all of these score sheets. And then the HESI. The HESI results will be entered, the 5 sections on the boxes on the left-hand side will be averaged together. Then that average will be divided by 25 to put it on a 4-point scale. So everyone will end up with a 3-point something 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 in box number 2. Everyone, no matter which score sheet you're going by, whether it's LVN, you're applying to our LVN program, whether it's the basic track program, or whether it's this one we're looking at currently, which is our transition. We will look at the total points down here, and we will rank everyone that applies based on their total point score. Then we choose the highest scoring people to start the program and some alternates. Some additional notes regarding applications to our nursing programs. All classes, in order to count in the selection criteria or ranking, must be completed prior to the application deadline. In other words, we cannot consider classes that are currently in progress. All 3 nursing programs require that you take the HESI pre-entrance test. These scores are used to rank the applicants. There are 6 sections that are required, and they are listed here: math, anatomy and physiology, reading comprehension, grammar, and vocabulary and general knowledge, as well as critical thinking. There are minimum scores depending on which program you're applying to for each of these sections. Additional notes about the HESI. The HESI must be taken by the HESI deadline posted on our website. Again, we will provide a link in the YouTube video that will send you to our website to the most current deadlines, both for the HESI and submitting your application and all required documentation that must be uploaded to the application. The HESI may be taken every 61 days if a student desires system-wide. If a student chooses to retest, they must do so on all 6 sections of the HESI. If you choose to retest, your most recent score will be used for the application score on all sections. And remember, you have to make the minimum score on all 6 sections to be eligible to apply, and that must be on your most recent score. In addition, the HESI score must not be over 1 year old by the date you submit your application in order to be used in your application score. A few additional notes for all nursing programs at Lone Star Montgomery. Nursing programs will require pre-admission drug screening, and the students will be responsible for the cost of the test. The nursing program will determine the day and which company will do the drug screening. This is just to repeat that the hepatitis B quantitative titer must be submitted at the time of application. It can take up to 6 months for you to complete your series of shots for the hepatitis B vaccinations, and then after that you have to wait, I believe it's about 6 weeks, before they're going to let you draw the titer to see if you're immune. So advanced planning is critical. There are other titers and immunizations required, but those are not required until you're accepted into the program. So when you look at our immunization policy, which will be on a handout in the links on this YouTube video, the main one to be concerned with at this time is the hepatitis B policy, submitting a quantitative titer at the time of application that shows you're immune. In addition to those requirements, after you're accepted to the program, students will have their Social Security numbers verified prior to starting the program and going to clinic. This is a requirement of our clinical facilities. In addition, once you're accepted, if you did not go to high school in the United States, you will have to meet our English proficiency requirement, and there is a separate document that discusses that, and I'll provide a link for that as well. It is important to note that health insurance is required for students in our nursing program. After you're accepted to the program, it will be a conditional acceptance about completing a background check. Candidates for Texas nursing licensure must do electronic fingerprinting via Texas Board of Nursing approved facilities. This fingerprinting will go to the Board of Nursing for FBI background check. Individuals with histories of felony convictions, mental illness, or chemical dependency will be considered on an individual basis after review by the Texas Board of Nursing. Thank you for listening to our nursing information session for Lone Star Montgomery. If you have questions, and you've had a chance to look around our website, please feel free to contact any of the staff members listed here that can assist you. Amy Robertson, the counselor, can help with nursing advising issues. Caitlin Long can help with questions regarding online application and required documents that you must upload to your application. And Lynette Dempsey can also help with all of these issues as well. Thank you for your time. Be sure to look over the links that we will provide in the description of this YouTube video, and let us know if we can help you as you strive to reach your goals with your education and your career choice in nursing.